When somebody's diagnosed with prostate cancer, not only are they grappling with a cancer diagnosis, which is of course upsetting and stressful, but they also have to now be confronted with all these different decisions and information they need to make in order to feel good about making an informed choice. So what we do ultimately is try to provide those resources and materials so men and their spouses, caregivers can make choices they feel are well thought out and informed.
In our Prostate Cancer Clinical Trials Consortium, we partner with quite a number of organizations to do what we do. So the NCI, the Prostate Cancer Foundation, the Department of Defense, we have a growing initiative with the Department of Veterans Affairs, which is, to my mind, one of our most important efforts, and this is to really work with the VAs to be able to get prostate cancer clinical trial access into VA hospitals around the country.
Zero is a patient advocacy organization in Washington, D.C. We've been around fighting on the front lines for patients for more than 20 years. When we talk to patients and their families, they just want to know that they're not alone. Zero and many other advocacy organizations really need advocates to come out to tell their story because it's such a critical way to get the message out. So whether they're talking to their elected officials, whether they are in their community doing health events and awareness events, what we always tell our advocates is it's their voice that really can make a difference and make those connections.
ACS CAN was created specifically to be the advocacy affiliate of the American Cancer Society. Victories are happening in the fight against cancer because of the incredible work being done in the research labs by the researchers, by the doctors themselves, by the administrators who support those doctors, by the patients, by the families, keeping people engaged in the fight and keeping their positive attitude is how we continue that fight.
Cancer should be talked about, not cancer, as it was in the old days. Prostate cancer is a completely global disease. It doesn't just affect the patient, it affects the significant other, the spouse, the partner, but it also affects families. We need to hear from those folks, and we also want to empower them to use their voice so that we can shape the research and the science to affect them and to affect others.